What are some of the most common misconceptions about trauma and that I encounter? A lot of people are trauma informed now. That's kind of the big buzzword, is trauma informed and resiliency. When I look at resiliency, it's kind of funny. Um, some people think, well, if I'm not feeling better, I'm not resilient, right? And that's not really what we're talking about. Resilience, a friend of mine, I believe, coined it, Christian Moore, the idea that it's the ability to bounce back. And when I went through my struggle, for example, I was able to go back to work, go through the motions, but I wasn't feeling back to normal per se. Many people struggle. It's like, well, why am I not feeling normal? And I think it's a lot of we're confused a little bit about what this concept of resilience is. It's just being overused a bit right now when you hear things like I heard the other day that the stains in my collar were very resilient, or the weeds in my garden were very resilient, or the shampoo that I buy can make my hair resilient. So just people are confused with that. And the other misconception is the timelines. People think, well, yeah, I went through that, but it's time to move on. Or there's a certain specific way to deal with this through this therapy approach, or some people will CrossFit their way through it. And if that works for one, it must work for everyone. So just misconceptions about that. The other misconceptions I think a lot happens with our young therapists or people going through struggle is that once I get through it or start feeling better, then it's over and I won't have any more of that. And just like me, my brother, this happened on Easter weekend. Seasonally, the seasons change just right now. And every Easter I struggle, every birthday I struggle, holidays I struggle. But it has gotten better, and most people will experience that. The other misconception is to think that, well, I tried this therapist and it didn't work. So that's enough of that. In reality, you may have to take multiple therapists, multiple attempts at therapy, multiple different approaches. I tried meditation, yoga, therapy, peer supports, just various things. What the misconception is that it's unique to you, and you're the only one going through trouble. And we know that many people struggle in this world. When we look at the general population, we generally see that at least 61% of the men and 51% of the women have gone through some kind of traumatic experience or will in their lifetime. And many people that have gone to mental health therapy, about 90% of them have. So if you haven't, you probably will go through some kind of trouble.